Welcome back to the Morning Blend. We've all done it. We've complained about how bad our back is killing us. Oh, my aching back. Sometimes that pain even keeps us from living life to the fullest or even getting a good night's sleep. But it doesn't have to be that way.
No, it does not. Dr. Jeremy Scarlett from Advanced Pain Management is here. He's got a new medical device that provides a safe way to treat the spine. And he says knowing if you're a candidate is as easy as asking yourself a simple question about grocery shopping. We're going to share that. Good to see you, doctor.
Yeah, thanks for having me on.
Good morning to you.
Yeah, I mean, back pain, everybody has it. I feel like if you're over 20, you're complaining about your back at some point in your life, and it just tends to continue to get worse. And that's something that we hear a lot. So I'm sure you hear that every day.
We do. Unfortunately, that is true. I have patients coming in to see me from their early 20s on up until the 90s. A few patients that are in their hundreds. So it's something that unfortunately does progress over time.
If you're 100, though, you earned back pain, right?
Absolutely. Yes.
Let's talk about the grocery cart thing, because I think going grocery shopping is something that all of us can identify with. And it gives you an opportunity to sort of explain something about the back and the spine.
It does. As people tend to age, they often will develop something called lumbar stenosis. Now, lumbar stenosis is narrowing of the spine in the lower back region. The spine can be narrowed in a couple of different regions. If this is a spine model, you can get narrowing of the spine in the spinal canal. You can also get narrowing of the spine where the nerves come off the neuroforamen area, where they come off the spine. That usually is because of deterioration of discs, ligaments, and also, unfortunately, bony spurs that grow into the spine over time. The longer you live, unfortunately, the longer this process has to develop. And people become symptomatic. Now, normally what happens is they're unable to stand for prolonged periods of time or walk for any significant period. And you may notice that in your parents is they're just not able to stand or walk the way they used to. And one of the things that actually relieves a lot of the pain with standing or with walking is actually leaning forward.
Yes. My mom does it every time at the grocery cart. I always say, do you want to push the cart? And she's like, yes, it helps my back.
Absolutely. A telltale sign of spinal stenosis.
Jeez. And I feel like every single person who knows that experience and knows the difference of walking without one or leaning kind of on one and the difference in the relief that it gives your lower back can identify with that. So that's so simple, I think, and relatable. What are other symptoms? I mean, if that's something that you feel, how would someone else know that they have this?
Well, often it's not just the shopping cart, it's just that people need to sit down over time. So sitting down actually flexes the spine and does relieve it. A lot of people also, before they develop the stenosis symptoms that are severe with standing, will have pain, just mild pain in their low back because the arthritic joints are already starting to act up, and that's part of what leads to stenosis. So there is this period of time where people just have this dull low back pain that then ends up leading to stenosis down the road.
So how do you treat it?
So traditionally, as an interventional pain doctor, we've treated it with epidural steroid shots. And you know, when it starts, that usually is pretty helpful. I'll send people to a chiropractor. They can manipulate the spine. They get some relief from that. But as it tends to progress, the only good option up until the last few years has been surgery. And the problem, the really sad part about this, is that surgeons are very honest. They tell people, hey, if we're going to do a laminectomy, we're going to cut out part of the bones of your spine. We might have to fuse it where we put in rods and screws. You're talking about a 2 to 3 month recovery, or even up to 6 months for some people. And older people just don't want to go through it. So sadly, it often goes untreated.
And people don't like fusing that word either, because I know a lot of people have pain with some of that. What about Vertaflex? What is that? How does it work?
So Vertaflex is a newer stent type device that actually we can put into the spine, where it starts to open up the spine without having to cut out any of the bones. Whenever you talk about cutting, that usually is pretty painful. This device, there's no cutting out of the bones. There's no rods and screws, and it stays in place. And actually, if you think about with a shopping cart sign, people are leaning forward. What this does is it goes down to the level of the spine that's narrowed and opens it up, so that people don't have to lean forward. The spine is actually it's flexed, so it's more open at that area.
Can you still move and bend?
You can still move. You can still bend. You would not know that you have this. Although some people will say, "Hey, I keep noticing my kids tell me I stand up more straight."
Huh.
So what do people expect after? Do they tend to have a lot less pain and more movement, more mobility?
That's the huge benefit with this, is that people usually have some tenderness for a week or two, but it's not the 2 to 3 to 6 month recovery that major surgery is. And people are able to sacrifice a couple weeks before they'll sacrifice 4 to 6 months for a major surgery.
Does insurance like it? That's what people want to know,
Yeah,
right?
absolutely.
Is insurance going to cover it?
This has been covered by Medicare since January of 2017.
Wow.
And some of the Medicare Advantage plans are now picking up on it because they realize that a lot of people just come in and go home. They don't have to go to a nursing home or anything afterwards to recover. The recovery process is much more benign.
That's fantastic. Do people need a referral for it?
No,
Not necessarily.
they don't need a referral from their primary doctor unless their insurance dictates that.
Yeah.
Overwhelming majority of people don't. They can just call us for an appointment and we can evaluate them for it. We'd have to get some imaging studies to make sure they're an appropriate candidate.
Yeah.
But as long as their MRI and their x-rays show that they're appropriate, then it's something we can do.
Wonderful. So you can learn more about your treatment options for lumbar stenosis. Here's the phone number to call. It's toll free, 888-901-7246. You can go to apmhealth.com/treatments also to find out more about advanced pain management and the things they can do to relieve your back pain. Wonderful. Thank you so much.
Thank you, doctor.
Thank you.